Are we good? All right. Good afternoon, everyone, on this Ides of March today. It is a pleasure to see everyone again. Week 14 of the vaccine rollout. Again, we've seen some positive numbers when it comes to both the declining rates of positivity in the state of Maryland. A little bit of a bump, it looks like, this weekend, but overall a downward trend that continues to be the case with death rates as well, which is a sign of progress. Still certainly have some ongoing questions around the equitable distribution. Some of our early trends seem to be holding. So looking forward to getting some more information on that front. But we do seem to see more vaccines going out. And so the process, I think, is where really the questions are. That's where we're fielding a lot of questions from our constituents. Still the fundamental question of where and when, and that clarity will be key. So with that, I want to make sure that we have plenty of time for questions today. Going to hand it over to Mr. Powell for our weekly update.
Thank you, Mr. President and work group. I'm just going to wait till I can see the presentation on the screen. We'll start off where we usually do, which is the change in some kind of major indicators about coronavirus since vaccines became available. The one thing I do want to point out on this, and I'll talk to it a little bit in a second, is that the percent positivity rate is slightly higher, a few tenths of a percent than it was when we met here a week ago. And I think it's too early to say that things are going in the wrong direction, but we'll keep monitoring that, obviously. Next slide, please. As you mentioned, Mr. President, vaccinations continue to kind of generally increase at about the same rate. We have added, so the blues are first doses, oranges are second doses, and stacked on top of those for the last week or two are the single dose Johnson & Johnson vaccines. So you can see how they were distributed amongst the days. I think this is kind of settled into a pattern that we've seen for a few weeks now. Next slide, please. This is the third week we've looked at this under the assumption that since we're vaccinating the right people that are most at risk of being hospitalized or dying from coronavirus, that we'll see a decrease in death rate that might exceed the decrease in the positivity rate. And I think we're still continuing to see that, although we have talked to Johns Hopkins epidemiologists about this, and they say, it looks like that's likely, but it's probably a little too early to tell. So we'll continue to monitor that. But I think a good sign generally. Next slide, please. This is where Maryland compares to other states in terms of the percentage of our population that's gotten a first dose and a second dose. So the states who have gotten a higher percent of their population first doses are further to the right. So you can see New Mexico is leading at about 29% of their population getting a first dose. And the higher you are, the larger percentage of your population has gotten a second dose. Alaska is highest at around 18%. Maryland, I think, is right in the middle. We're like 25th in first doses and 26th in second doses, or I might have that backwards. But I think an improvement from a month or so ago when we were looking at this, and we were generally kind of down there in the lower left as far as percent of our population getting a vaccine. Next slide. This shows the percentage of doses that we have in our possession or that have been allocated to us that haven't been used yet. And again, you see the improvement that Maryland saw over the last couple of weeks, where we moved from sort of the lower tier, that's the blue line of states, into the middle tier, which is that orange line. The yellow line is kind of the 10 states that have used the most of what they've been given. Next slide. So this is a little bit different and it's a little messy, but this is the daily vaccination rate that's smoothed out a little bit over the previous week by county. This one shows the 8 largest counties in the state. So Howard County is the green line that you can see in the upper right. So recently, somewhere around maybe 0.5% of Howard County's population is getting a first dose vaccination every day. They are the leader amongst the 8 largest counties recently. And I'll also point out the Prince George's County line, which is the orange line at the bottom, much behind everyone else back in January. And now, while still lower than those other states, has a rate that's kind of closer to what we're seeing, counties in other counties. And we'll see the impact of that on the next slide. So this is basically that same data, but cumulatively. So before it sort of showed how you'd been doing over the last week, this shows how you've been doing as of each point in time. And so Prince George's County, while not falling further behind really, is also not making up ground. You can see Baltimore City is the yellow line there. Howard County, as mentioned before, is the green line. Let's quickly look at the other counties on the next slides. This is for Southern Maryland and Western Maryland, I believe, and I can't begin to describe what this tells us. Next slide. You can see the cumulative rate of vaccination in those jurisdictions. So Charles County is the yellow line at the bottom. They're at about 10, 11%. The blue line, I believe, is Garrett County, which, first dose vaccinations of around 17 to 18%. Next slide. This is for the Eastern Shore. What's interesting on this one is Kent County, the yellow line, which you see two big spikes of vaccinations back in late January and mid-February. And you'll see the impact of that on the next slide, which shows that at that point in time, Kent County sort of jumped to the head of the pack as far as percentage of their county that had been vaccinated. So this is just kind of shows the way that those two slides work together. And the next slide. Same thing for gender. So I think initially women were being vaccinated at a much higher rate. Recently, I think that continues, but it's much smaller. So I think for about every 5 men that get a vaccine, 6 women get a vaccine. That is probably the smallest difference in that rate since we've been looking at this. And on the next slide, you can see the kind of cumulative impact of that disparity over time, where I believe women have been vaccinated at about 50% higher rate than men have cumulatively up till now. Part of that, I think, is because a slightly larger percentage of Maryland's population is female. I think a slightly larger percent of Maryland's like 70 and over and 80 over population is female. Next slide, please. This shows those ages. So you can see those big spikes initially for first the brown line, which is folks that were 80 years and older, and then a little bit later the blue line, which is those in their 70s. And you can see recently that big spike in the green line, which is Marylanders in their 60s getting vaccinated at higher rates than they were before. Next slide. And this is, again, just the cumulative impact of those sort of daily vaccinations. 80-year-olds in Maryland have gotten a first dose. It looks like about 55%. Those in their 70s are around 50%. And you can see what that is for the other age cohorts. Next slide, which I think is the last one. It is, and so usually we like to take a pretty close look at those similar demographic numbers by race and by ethnicity. I think MDH has been trying to clean up some of their data, and in looking at it, I mean, you can see that recently the reports for the first dose cumulative and second dose cumulative by race are exactly the same. I don't think those numbers are reliable. And so unfortunately this week, I didn't do any analysis on race or ethnicity just because I didn't have confidence that the data was as accurate as it can be. So I'm hoping to get that sorted out and next week be able to pick up again where we've been before on race and ethnicity. President, that's it for me.
Mr. Pratt, can you go back to slide 14 for a second? I just want to ask, just check something quickly.
Sure.
So it looks like on the 24th, there was that big change, especially for under 50 as well. I mean, you start to see the decline in 70s. And was that February 24th? Is that from 1A to, was that from 1B to 1C? Is that date?
I don't recall exactly what that date is, and maybe the health secretary might have a better recollection than I do. I apologize.
Great, thank you. All right, let's go ahead and go to Acting Secretary Schroeder. Oh, Secretary Schroeder, we have you on mute. There we go.
Can you hear me now?
Yep.
Okay, thank you, Mr. President. Good afternoon, Senators. There's the first slide. But while we're on it, let me just answer your question. We made the change from 1B to C on the 25th of January. So it was about a month before that. So I just want to get that out of the way since you asked the question. I did want to, if we can go to the next slide, we've drafted, based on an idea that you presented, a one-pager that has information for Marylanders who may need help from the state to distribute at our mass vac sites. The one-pager will have contact information for mental health, unemployment, and a host of other assistance provided by the state, and when it's finalized and printed in the coming days, we'll hand it out to everyone who's vaccinated at our mass vac site. So that was your suggestion, and thank you for that. Next slide, please. Last week, I visited organizations that have served underserved, vulnerable, minority, and homeless Marylanders that have now partnered with the state to administer COVID-19 vaccinations and provide other pandemic-related services to their clients. The visits further affirmed that our hybrid approaches to fighting this pandemic, in particular how we are vaccinating Marylanders as quickly and equitably as possible, is working. There are now numerous ways to inform Marylanders how to obtain a vaccination, which they are getting in record numbers. Next slide, please. Over the weekend, we launched our new pre-registration system through covidvax.maryland.gov for Marylanders in phase 1 to receive a vaccine at one of the state's mass vaccination sites. As of this afternoon, over 35,000 Marylanders have pre-registered, and we have experienced no technical issues. They and the thousands of others we expect to use the system will be notified once an appointment is available, to verify their pre-registration status and to reserve an appointment. You can also pre-register by calling 1-855-MD-GO-VAX, which is our vaccination support call center, so that either way, whether you call or you go online, you have the same access. And our outreach to minority, underserved, and vulnerable Marylanders via trusted local providers is also contributing greatly to our ability to vaccinate hard-to-reach populations. If I could get the next slide, please. So on Tuesday in Gaithersburg, Brigadier General Burkhead and I visited a pop-up vaccination clinic organized by Community Cross. They're a local faith-based group serving minority populations in Montgomery County. It's one of the dozens of partnerships we're forging to vaccinate vulnerable populations where they are in the community. And interestingly, at Lake Forest Mall, Holy Cross Hospital health workers administered 115 first-dose COVID-19 vaccinations to Hispanic, Black, and other minority and vulnerable populations. And the great part about it is that Community Cross used their list, and they used their communications to make those appointments. And because they know that population so well, they had almost 100% attendance. It was quite a visit, and we were very interested in the results. This site is also just down the road from our existing efforts at Kaiser Permanente's Gaithersburg location. Kaiser Permanente has been a valued partner in reaching out to they have 500,000 clients or members in their health plan, and of that, 36% are African American and 12% are Hispanic. So that's one of the reasons why we targeted Kaiser early on, because of their their member demographics, and that they're doing a very good job. Next slide, please. This past Friday, I visited Healthcare for the Homeless in Baltimore. They annually treat 10,000 patients, and in partnership with the state, began COVID-19 vaccinations in late January. We started that, and then interestingly enough, about 4 weeks later, the federal government started the same process. So we were very happy to partner with the 17 federally qualified health centers, including Healthcare for the Homeless. Kevin Lindemood, the CEO, shared that having one-dose Johnson & Johnson vaccination would enable them to more efficiently vaccinate their clients. So I was gratified to hear that from him, with somebody who's actually on the ground serving hard-to-reach populations. anyway, these are just two examples of our working with trusted local organizations. So when I talk about trust, I'm talking about trusted local organizations who know the people on the ground and to help us overcome the challenges so that we vaccinate Marylanders as quickly and equitably as possible. Next slide, please. So as you can see, our hybrid approach is producing remarkable results. In 14 weeks, we have vaccinated more than 1.9 million Marylanders. We are consistently averaging between 42,000 and 43,000 shots per day, which is really what our supply allows for at this point. According to the CDC, Maryland is now ranked 19th in the nation in the number of residents vaccinated, and Maryland is above the national average for first doses, fully vaccinated, and doses used. Next slide, please. I want to close by talking a little bit about the address President Biden made in his announcements last week, calling on states to prepare to open vaccination eligibility to all adults by May 1st. There is no question in my mind that we are ready for whatever amount of vaccinations the federal government is able to send us because of the infrastructure we're building. The governor has always set the bar high for us, and we have and will continue to deliver. When the hospital patient surge model said we needed 6,000 hospital beds last spring, we moved heaven and earth and did it in a matter of weeks. When the governor wanted 20,000 tests a day by the summer, we hit 30,000, then 40,000, and then 50,000, and we are still doing testing in those high ranges. We have shown we can do the same with vaccines. On Friday, we vaccinated 56,320 Marylanders across the state, a new daily high. This week, we will hit 2 million total shots in arms. We opened the distribution channels, we've built the infrastructure, we've stress tested the supply chain, we've stood up the technology. One test of our hybrid vaccination distribution system was when the Johnson & Johnson vaccine was rolled out 2 weeks ago. Some states had some challenges getting it up and running. Some are actually still stretching out that initial allocation. We did not. The governor wanted 100% of what we received deployed and into arms right away. And we were able to do that by combining speed and equity. We got it to our mass vaccination sites, and we also distributed it to the hospitals and to every local health department. I'm pleased to say that we had one of the fastest rollouts of Johnson & Johnson in the country. We fully expect to replicate that kind of success when the vaccination supply spigot finally opens very soon. Senators, I look forward to your questions.
Thank you so much, Mr. Secretary, and certainly some, no question, positive news on several fronts. I have a couple areas of questions that I want to ask, but I want to make sure that I leave time. The first is about the pre-registration site, which I think is a very positive development. I guess very briefly, have any local jurisdictions opted into making that their primary registration form?
Not yet, but we are offering to all local jurisdictions to work with us. The way they would do that is they would refer their pre-registration list to us. We can also, if you recall, dedupe that list. We're actually working with Prince George's County right now, and we found that 25% of their list already had appointments or were vaccinated. So we're helping them with that. And then they'll give us their list, and then we will probably refer, we want to refer that list to our new site because we get a lot more information. Some counties, they're varying across the board, and some only have emails, some have other contacts, but we go through a very rigorous set of questions in the pre-registration so that we can help them manage access.
And it was very robust. I did it with my wife just to go through it as a trial to see so that I could see how it went through. There's a lot of information. What is the algorithm that will send people? Is it based on, will it be age priority, geographic priority? What will be to pull people off?
Well, we're still working through that. It will vary depending on the need at the time, because we may pivot.
Right.
But obviously what this allows us to do is to facilitate access and equity. So I've been saying for quite a while now, speed and equity. So it depends on what we want to accomplish in the, week over week as we go along. So that's why it's got so much information, so that we can query and ask a lot of questions.
Got it. Okay. Our federal partners sent a letter early in February asking for how the funds, that federal dollars, would be used. And I don't believe they've received responses from March 1st and 15th to the CDC about how the $400 million in CARES money would be utilized. Is that something that has been submitted?
It's actually due this week. We reviewed it last week, and that'll be, we spent a fair amount of time making sure we thought through it, because we have we want to make sure all our needs were being. So sure. It's due this week.
In that letter also included some contract language, and I appreciate sending the scope of work on the Ernst & Young. It looks like they have a very robust presence in the vaccination program. There was the component that was the phase 1 that talks about the 7-day review of the program. I'd be interested in some of the highlights of what they had recommended, but would really most be interested in seeing that report and seeing how it played out. I don't know if that's something that maybe we can follow up with through this week's questions, but if there are some highlighted pieces of that 7-day review that they did.
Well, we didn't ask them. I mean, because this is a hit the ground running and roll, we asked them to give us their recommendations. Not, this wasn't about getting a report that we put on the shelf. Right. They started working immediately on expanding our supply chain and allocation process. So, for example, we were trying to figure out how to get visibility in Tiberias on the long-term care program, and they immediately dug in and helped us. They've been helping us with national best practices on the mass vac sites, long-term care, contract tracing. So they've been helping us on a number of things. But I will mention one other thing, that EY is in many states. So they're in California, Georgia, Maryland, Missouri, North Carolina, Arizona, doing this. And then based on some of the questions we've gotten, we went out just to reassure ourselves that almost every state has somebody like this. Some of them use two. So like Alvarez and Marcel is in Rhode Island. Accenture is in California and North Carolina. Boston Consulting Group is in Connecticut, New York, and Pennsylvania, and Deloitte is in Missouri. And that was just a very quick and dirty. Yeah,
are they doing staffing too? Like the staffing side? Is that?
They're in some areas where we need high-end capability. They're providing staffing, but as working through the Unified Command with MEMA, we're using as much of our own staffing and hiring under the state personnel contract situation.
Great.
But where you need very sophisticated supply chain knowledge, we're using them, and they're helping us where we can get value.
Okay, thank you very much. Let me move over so we have plenty of time here. We have first will be Senator Eckert, followed by Senator Lamb, Senator Rosapap, Senator Washington, Senator Young. So Senator Eckert, you are up.
Thank you very much, and thank you, Mr. Secretary, for continuing to be so diligent and focused on this. I get the same question all the time. When will phase 1 be completed, and when will you open up to phase 2? I get that question, and then I continually get, how do we know how many people totally in phase 1 have already been vaccinated? Now, I know I usually tell people and break it out by the age groups and then allow for all the healthcare workers. That is an undetermined amount, but I still get, my neighbor's 25, they were able to get it, I'm 62 and compromised and I can't get in. I've been waiting.
So, in phase 1, we had a little over 2 million people. We vaccinated close to, as I said earlier, 1.9 million have one or the second shot. There's almost 700,000 that are fully vaccinated. But here's the thing to remember. Let's go back to first principles. First principles are protect the healthcare workforce. And that took 3 or 4 weeks, and that they got about 60 or 70% uptake. There are a lot of young people that work in the workforce, but we didn't want a 25-year-old running around a hospital infecting somebody who's in their 70s. So that made good sense. Then we vaccinated the long-term care facilities. Maryland was much more aggressive than many other states in doing that. And we did first responders. So if somebody came to your house and you're having chest pains and you're 65 years old, we didn't want a 35-year-old EMS provider passing COVID to you. So when you look at that, it makes a lot of sense that people in those occupations who would be younger would get vaccinated.
Thank you.
All right. Thank you, Senator. Next up is Senator Lamb.
Thank you, Mr. President. So I'm glad to hear that the pre-registration site's now been open. I think it's an overdue but promising development, and also positive to hear that the counties, that the local health departments have been maintaining wait lists, would be able to participate in that centralized pre-registration process. When will this be open up to the rest of the providers that want to participate?
Let me clarify your question. You were talking about pre-registration, but then you asked about other providers. That's 2 different questions.
No, it's one. It's one question. It's the question of you've created this pre-registration site, which I think is positive, and then you, in answering the Senate President's question, had said that you potentially be open to having local health departments, fold their wait lists into this as well. And so my question is to stem from that further. When would you be able to open this up to other providers as well?
Okay, let me take a stab at what I think you're asking. We have over 400 primary care providers around the state under our primary care program. We are doing a pilot this week. We have sent 1,700 doses to 17 different providers across the state. And we want to test that this week, and we're going to start cranking up the number of providers that receive doses. And our expectation is,
are they going to be able to participate in the centralized registration process? That's the question.
Well, we haven't talked to them yet, but I'll be very honest with you. My hope is that they have better lists than we do. I don't want to put a bureaucratic process between them and their patients. I want them to get the doses and go to their patients and say, I think you should have the shot. They call them and they get them in the next day. I don't want to go through some bureaucracy that is going to extend the time for patients and doctors to get together.
Yeah, I mean, I'm just curious because I think it goes back to the old way of thinking of having everyone register. If they have different providers, they're registering different providers, different hospitals. I think this development of having a single pre-registration site is great. But I would encourage you to think about bringing other providers on board into this as well. The other question that I had to do with the news story that appeared in WBAL, where it said that several vaccine hunting groups in Maryland had met Friday with local and state officials on a Zoom call to talk about what they are calling racial profiling incidents at retail pharmacies. And the contention there is that people of color that are coming in to get vaccinated are being asked for identification more frequently than those who are white. What is the department doing to address this concern? Because obviously this contributes to Black and brown people being less likely to be able to get vaccinated.
Well, obviously we're not happy about hearing these reports, and we are investigating them. I don't have the outcome of that yet, but we're not gonna, our guidance has been that all eligible people who come to a provider are required to get a shot.
Do they need to show identification?
No?
Okay. And then based on
Now,
last
they
week's
do,
data,
they do
thanks
have
for,
to show whether they're eligible, of course, right? I mean, if you're 65, that means you're
Well,
eligible if you're 60.
that's the thing. It seems like a lot of people that are white fewer people that are white are being asked that question to provide identification or verifying information than people of color.
Yeah, that's unacceptable.
Okay. Well, I would like to hear maybe in a future meeting what your plan is to address that once you've had a chance to investigate. Based on last week's data that you submitted to us, MD GoVax has booked 27,000 appointments. At the same time, this is since MD GoVax was opened up, you've gotten over 113,000 calls for appointments. This is just shy of about 50% of the calls coming in. So it's 27,000 appointments, 113,000 calls. That's less than a quarter. That's 24% of all calls that are coming in are actually getting an appointment. That means 75% and over 3/4 of the calls that are coming into MD GoVax are actually not getting an appointment. People are spending a lot of time on hold. They're getting very frustrated. And then at the end of that, most people are actually not able to get an appointment when they call MD GoVax. What should they be doing? Should they just keep calling again? Because that's the advice that they've been getting that we're hearing from our constituents.
Unfortunately, the supply has not increased yet. That will change overnight when the supply changes.
Okay, so less than
And I would also
quarter of the
offer one other
people are
thought.
getting appointments, but they should just keep calling.
Yeah, no, I would offer that what we're going to do next, let me be careful about how I say this. When you call GoVax now and you don't get an appointment, we are going to pre-register you so that you go into the pre-registered. Because remember, you can get pre-registered by going online or you can get pre-registered by calling GoVax. So either one. So now if there's no appointment, we will pre-register you.
That's new because you wouldn't, I know in prior weeks when somebody called in, they couldn't pre-register. So I think that's a positive development.
Over the weekend.
Right.
Yeah.
Okay.
Yeah, it was just announced over the weekend.
Now with President Biden's recent announcement that vaccine supply will be much more abundant come May 1st, and that anyone that wants to get a vaccine, or there will be enough supply for everyone that wants to get a vaccine come May 1st. How will you ensure that everyone that is above the age of 75 or above the age of 65 can get a vaccine by the time you fully open that up on May 1st? Otherwise, my concern is that the older people will always lose out to the folks that may be more technologically advanced and can scroll through and refresh all the time. You know, we don't want to leave our older individuals out in kind of this constant Hunger Games of competing against the younger people once May 1st comes and the vaccination criteria is fully opened up to everyone.
You must have something in my meetings. Are you monitoring my meetings? My objective is to leave no one behind. So what we're going to do, if you remember, we have a Southwest model, and with the beauty of pre-reg now is when somebody pre-registers and they're 75 years old, we're going to know they're there, and they will get what we're calling a fast pass to because even though when we go to phase 2, we're still going to focus on the people who are in phase 1.
I know, but this is the same issue that we had by moving to phase 1C very quickly, that you were leaving the folks that were above the age 75 competing against those that were 65 to 75, who oftentimes were more technologically savvy. And so what are you going to do to ensure that people 65 and above can get a vaccine if they want to, because they really should be towards the front of the line before you fully open it up on May 1st?
Well, that's the whole idea behind pre-reg, is that we will know if somebody pre-registers and they're 75 years old, we are going to target them and we are going to get them into an appointment and they will go to the front of the line.
Okay.
Just to jump in here
well,
quickly.
I'm just hearing that pre-registration.
On that point, will there be allocated doses at sites for pre-registered appointments?
We haven't gotten that far, but we're going to use pre-registration to make appointments. So we'll have the appointments, and as you asked earlier, we're still working out how we want to. It'll vary depending on which part of the state you're in. But I think the Senator Lamb's question is right to the point. We want to know, and we're not going to leave anybody behind. So If there's, if there's 175-year-olds pre-registered, they're going to go to the front of the line.
Last question then is, my understanding is that you've entered that MEMA has entered into a 9-month contract on February 4th for $17.5 million with Haggerty Consulting. Can you explain what they're doing for the vaccination program?
I'd have to get Russ Strickland to give you more detailed information, but the big picture is that Haggerty Consulting is one of the premier emergency management consulting companies in the country, and they are helping us. We probably have 10,000 people working on this project, and they are helping us figure out the staffing models and making sure we got enough people, among other things. So I'd have to defer, and if you want, next week I can get Russ to be part of this, or we'll go get some of the answers. But Haggerty has done a terrific job for us.
Okay.
Yes, if you could provide us more information about that later, because by my summary, it looks like we've spent over $63 million in emergency procurements if all options are executed by the end of this. So I'll close there. But yes, if you could provide us more information.
If I could offer, Senator, by contrast, we spent probably $600 million on PPE. So what we're spending now for vaccine on this pales in comparison to what we spent for PPE last spring.
Thank you, Senator.
Well, you could have also bought several million more South Korean tests as well.
Thank you, Senator. Thank you, Senator. All right, Senator Roosevelt.
Thank you very, very much, and I apologize for looking like I'm in my car, because I am in my car. Mr. Secretary, first quick question. Is the pre-registration list creating a waiting list?
Well, in effect, that's what a pre-registration system does. Yes, sir. But it allows us to manage the list based on all the data we're collecting.
No, I get that, but I'm just saying, if somebody calls in this afternoon and they can't schedule an appointment, they'll go on a waiting list and someone will call them back to schedule?
Yes.
Perfect.
Yeah, we're going to call people.
That's a great step in the right direction. Okay. I want to give you 2 pieces of good news. The reason I'm out and about is because I had to stop by a drugstore to get something unrelated to COVID. So I asked the pharmacist at my local CVS, do you have COVID vaccines? She said, not right now, but we had them last week, and we're going to have them again. So little neighborhood CVS in Prince George's County has had vaccines. They're going to have more vaccines. Great step in the right direction. Second good news, I have a constituent who is a member of Kaiser Permanente. She signed up every place. The only call she got back was from Kaiser. They scheduled her. She came in and she got her first test last week. So these are 2 great steps in the right direction, and I applaud you and them for doing that. 2 questions going forward. President Biden's goal of May 1st, everybody is eligible to get a vaccine. And you may not be able to answer this today, but I would appreciate it if you could get us by next week a schedule for when you will have the plan that you can share with us as to how you are going to make sure that when everybody's eligible, everybody will be able to get a vaccine if they want one. We're going from a period of scarcity to a period of abundance, and we need a plan to show that. So if you could share that with us next week, what your plan is, how you're going to make that happen, I would appreciate it.
Yeah, thank you, Senator. We're developing those plans. We've been developing those plans. Actually, where we are has been preparing for this moment all along. So we're very happy. We'll pull something. And of course, we'll inform you week over week.
Right, but I'd like, if you can, if you can't, you can't. But I think if we could get that next week, if we can't get it next week, get it the following week. I mean, we're only 6 weeks away from January 1st. And
that's,
so
if
we don't get our shit together now, we're not going to get our shit together later. So if we could see that plan, that would be terrific. Second question is, as you know, I hammer away at Prince George's because I live here and I represent the people of Prince George's. And the data continually shows, despite everybody's efforts, including yours, to do better in Prince George's, I would also like to have a plan to get Prince George's up to the statewide average. It's ridiculous that the second largest jurisdiction in the state, the jurisdiction in the state which had the most COVID infections, where we have some of the hottest spots in the state, is so far behind every place else. And I know people are trying, but I just think we need a plan with metrics and a goal to say, by this date, our goal is we're going to at least get protection of people in Prince George's County up to the statewide average. Is that a reasonable request? Is that something you guys can do?
We're working on that every day, Senator. I don't know if you saw, we're going to be at First Baptist Church tomorrow in Glen Arden.
I'm for that. I'm for Glen Arden. I'm for Six Flags. I'm for CASA. I'm all this stuff. But I'm not talking about micro anecdotes. I'm talking about a strategy that's macro, that says Prince George's, I don't have the numbers in front of me, but basically Prince George's continues to be like 30%, 40%, 50%, 60% behind the average for the state. Not the best performing counties, but behind the average. And it seems to me it's the right thing to do, to have a strategy in cooperation with the Georges to get us at least to the average. I'd like a date on it. I'd like metrics on it.
Yeah, two other thoughts on that, Senator, and I don't disagree with what you're saying. We're working very closely with Prince George's. We've got a very good working relationship, and their team is working very hard.
They are.
You probably saw today, we just announced that 2,100 appointments are going to be reserved for Prince George's County residents at Six Flags, in addition to Glen Arden. But as you said, but my strategy, here's the thinking, this is my theory on this. The more we reach these local organizations at the grassroots and we start getting momentum, I think by word of mouth it'll start to spread and the demand will go up. That's my theory. Top down is okay, but bottoms up I think is a big part of this.
Mr. Secretary, we've had this conversation before. The demand is there in Prince George's County. The demand is there. People are on waiting lists. They're not just not getting the shots. Demand is not the issue. Organization of delivery is the issue. When I see these charts that show twice as many people in Montgomery or twice as many people in Baltimore County are actually vaccinated compared to Prince George's, it's not because people in Prince George's don't want to get vaccinated. There's some institutional issue. There's some delivery issue. I totally agree with that. A great conversation with General Burkhead about working with community organizations. But we have to get this to scale by May 1st, because after May 1st, as Senator Lamb pointed out, we're going to have all these other people qualified. And if it ends up being with all the wonderful people in Senator Lamb's district in Howard County, and all the wonderful people in Frederick County, and all the wonderful people in Dorchester County who drive to Prince George's to get a vaccine, it ain't going to help the people in Prince George's. So we need a plan to get Prince George's to where it needs to be before May 1st. If you'd consider it, I would appreciate it.
Yes, sir. No, and I don't disagree with you. We're on the same page. So let's talk some more.
Thank you,
I look
Senator.
forward to it. Thank you, Mr. President.
All right, Senator Washington.
Great, thank you. And again, thank you, Acting Secretary. And like everyone else, we're glad we're moving in the right direction towards more coordination. We have more vaccines coming out. And you referenced President Biden's pledge, and we all have a lot of confidence in that. I have a couple of administrative questions, and then I have a couple other, if you don't mind. One, building on the president's conversations about us eradicating COVID, he talked about the federally qualified health centers. And this builds a little bit on what I think Senator Lamb is saying and others about engaging other providers that are directly in the communities that need to be most targeted. Are we extending to are you working with the federally qualified health centers in Maryland? How many are there? What's that plan to begin to use them as primary providers of the vaccine?
Well, thank you, Senator. As you may not know this, but we were the first to do all 17 federally qualified health centers about 6 weeks ago. Okay. And before the federal government gave them doses, we started giving them 100 doses a week to get the pump primed. There are about 300,000. I'm very committed to this because having run the Medicaid program, I'm well aware of the critical importance of federally qualified health centers. They have about 300,000 members, and we are going to continue to work with them to drive, because I think they're a really important part of reaching the minority and vulnerable population.
Right. So I guess I'll ask the question again, maybe slightly differently. So you're giving them each 100. So we also established earlier that by setting up these mass vac sites that it's going away from some of the other sites. So I think what the president is suggesting is that we're investing more in these federally qualified health centers. So I'm looking to see, what's your plans to push more vaccines to those federally qualified health centers? That's what I'm looking for.
Right. We ask them how much do they want every week. So far, over the last 7 weeks, we've given them 14,710 doses, and they have administered 11,997, or about 81%. So many of them have asked us to slow it down a little bit. But when we ask if they want more, we'll give them more.
Oh, okay. So they've asked for fewer doses. You're saying that
in some cases, not across the board.
So which ones? Any in my district? I'm not aware of any in the 43rd district.
I'd have to get the data from our team. I can help you with that. Yeah.
We definitely want to know, what federally qualified health center in Maryland asked you to give them fewer doses than what you were providing them for. That would be really helpful.
Well, and in fairness to the federally qualified, they're growing their capability. They've been doing a terrific job so far,
Sure.
And we want to grow their capability. That, as a matter of fact, I mentioned healthcare for the homeless. I talked to Kevin Lindemood. He wants some more. He's asked to have both the federal doses and our state doses. We're going to honor that request. So,
I'm sure they could administer 1,000 on their own. I'm confident they could do 1,000 in a couple nights with the right support.
Yeah.
I believe we sent you some questions about who's in charge of staffing up, like how many people are staffing this effort. So what's your current vaccination staff? And it sounds like now we have 2 contracts, large contracts, I guess, of individuals or consulting firms. So who's running the incident command structure?
So we did receive that. We did receive it a bit late, Senator Washington.
Late.
It is it's a link in the provided document.
Sorry about that. Okay, we got it late. It wasn't when I was preparing then. So did we get the answers about the criteria moving from phase 1 to 2 and?
Say more.
Yeah. So I guess I have a question about. So we're doing this whole age-based approach, and the National Center for Biotechnical Information and some bioethicists, and I know we're sort of down this path, and lots of people are down this path, but as a public health entity, as a Department of Health, targeting before we're moving to different phases, what's the degree to which you are assessing within 1A, 1B, and 1C, the risk of infection? That should be the prioritization, right? The risk of severe morbidity and mortality, the risk of negative social impacts, and the risk of transmitting infection to others. There appears to be a lack of that sort of foundational principles of public health when we're looking at risk-based criteria, and that is the explanation for the lack of underperformance or, in minority communities and low-income communities who are disproportionately at risk of acquiring an infection, at risk of morbidity and mortality, at risk of negative societal impact, and risk of transmitting others. If you orient that way, has there been some discussion about risk-based assessment within these phases to make sure that you take care of those individuals before you move to the next phase?
So a couple of thoughts about your question. One is we are definitely using that thinking and I think we've talked about the Baltimore Convention Center. We know what the most at-risk zip codes are. We've got that analysis, and we're putting people on the ground in those zip codes to recruit, and we're providing Uber and Lyft and community health workers through that process to get people vaccinated, and we're applying that across the state. because you're exactly right. We got to go find folks. Now, the other side of that coin is that we also have to have, so there's a speed and equity issue. If we get 300,000 or 150,000 or 200,000 doses, whatever we get, we got to get those shots in arms. So we got to do both. We got to do both.
Mm-hmm. Yeah, it's interesting. There is that reallocation, sort of that threatening. And I think I know we mentioned 3 weeks ago that everyone who does this work, all the public health and community health, said that if for these vulnerable populations, you need to hold back some because it's going to take a little more time. So it's just, again, a concern that we can get them into 300,000 arms, but they won't be the right arms. And in fact, specifically here, there's something I want to draw your attention to. Apparently, individuals who are high school, like seniors and juniors, or college students who do summer camps are presenting themselves as healthcare, as childcare workers, and there's some loopholes there. So people are reporting and they're bragging about it on Facebook. So it gets forwarded to me. So I thought I'd share it in this meeting. Hey, I was able to get my 70-year-old. I was able to get, and none of those meet any of those risk of acquiring infection, morbidity, mortality, societal impact, and contribute to these disparities where Charles County is still down, Somerset is still down, Prince George's is still down. We still have these large loopholes where, so how are you addressing that? Were you aware that was happening?
Well, there's also a moral dimension to this, Senator, that people will use their good judgment and their moral compass to do the right thing. We're not going to police the vaccine centers. The bottom line is there are certain people that are eligible, and I'm just hoping that people will do the moral thing. Right,
but then we get reports but just to finish, we get reports that individuals or people of color are being held somehow as being perceived as less moral when they present themselves for the vaccine. So you really, I believe, need to get a handle on that, make some public service announcements. If you want to raise the moral responsibility of wait your turn so that we can get the more vulnerable people to get their sites. I mean, I do believe that that's the bully pulpit that you and the governor can be using rather than saying, one jurisdiction is getting more vaccines than they deserve. So thank you, Chairman.
Thank you, Senator. Senator Young.
There we go. Thank you, Mr. President. I have a couple of questions. I'm just going to run through them and not talk much. We're running out of time. Let you say what you have to say. I understand last week at a meeting of the counties and all, you said that ignore the recommendation of 6 feet away in schools, 3 feet's okay. And a lot of people were kind of alarmed by that and want to know if that's the actual policy. Second, just want to check on all sides. Is there any problem with us sharing everything we get with locals? I'm getting a lot of requests from locals about how certain things are happening. And then the final part, I'm getting constant questions. Who's making the determinations of who gets how much vaccination? And they're wondering, are there things they're being penalized for that they don't know about? Like Frederick gives a lot on Saturday, but you take the counts on Friday. Should they stop and try to give them faster? What factors play into that? And as part of that, Senator Rosenpep mentioned that he'd like to see more of those vaccines in Prince George's County going to Prince George's County people. Well, I know my people here and probably a lot of other places would be fine with that. They don't want to drive to Prince George's County or Washington County or Cambridge to get vaccinations. They'd like to get them here. You said there's pop-up places. Can anybody start one? How do they do that and get vaccines for it? I know Jan Gardner's trying to start a drive-through here, and she'd love more vaccine. They just don't know who's making these determinations, how they get it, who can do it. Is there any plan on that we don't know about? How's it all happening? And how somebody participate in it? That's it.
Okay, Senator, let me take the first two questions, and then I think the second three wrap together. The guidance that you're talking about, we were asked about the 6-foot distancing guidance from CDC is guidance. And so I was asked, is there a hard and fast number? And the answer is the guidance is to be applied by the local jurisdictions as they see fit. So it's guidance, it's not requirements. So that was the answer to the question. So people may have heard it different ways, but it is guidance, and that's out of the CDC. Anything we give you, you're more than welcome to share, and a lot of what we talk about here is materials that are in the public domain already. So no problem sharing any of this. We welcome it because that helps us, quite frankly. I've told the Senate President, that these meetings have actually been terrific because it's allowed us to push information out to the public one time in this format. So I've really appreciated that. Let me cover the allocation question. I just spoke. Right now, we are looking for the next wave. Getting back to some of the earlier questions that we had, the next wave of where we're going to go to create more capacity as we get more doses into the state. So we're having conversations with a number of local jurisdictions. We'd like to take places that are already working and expand them. And in some places we may have to build new capability, but our first preference is to work with local health departments that can grow. I spoke with County Executive Gardner on Saturday, and we're meeting this week, I believe. I don't know if the meeting's been set up yet, with Jack Markey, who's the emergency manager down there. So I've had that conversation with the county executive. In terms of pop-ups, General Burkhead is talking to every jurisdiction in the state, and she's working on getting those relationships on the ground. And if you would like to recommend a couple of local groups to us, we'll give those to her, and she'll meet with them, and we'll set that up. So we're more than happy to do that. And then as far as the allocation goes, we covered that last week, where we allocate on a pro rata basis by population, and then approximately 30% go to the local health departments, week over week with a 4-week projection. Then we dedicate another percentage to the mass vac sites, and then the rest goes to community providers and hospitals. And then we use Immunet on the back end to see where who's getting vaccinated statewide, so that we can level the playing field. So if a lot of people are going to the mass vac sites from a particular jurisdiction, we make sure we adjust so that every jurisdiction is getting a level pro rata share of the vaccine.
Thank you very much. Thank you, Senator. We do have to call it for now. That just reminded me of a question I forgot to ask, but maybe it's something for follow-up, is just whether there will be zip code reporting. So maybe that's something we can touch back on. I think it was really helpful to have the zip code for the infection level, so we could see where the disease was traveling. But I think it'll be helpful on the back end to have a herd immunity by zip code, starting to know where is herd immunity being reached by zip code. With that, I want to thank you for your time. Thank you, senators, for your participation. Have a safe week, and we will see you next week for week 15.
Thank you, Mr. President. Take care.
Take care.